One of the important things to understand about facelifting is that it's so emotional, that it's not very painful. You're able to get up and walk around the very next day. But because it's the face, it's a very emotional procedure, and I make sure that I tell my patients this so that they can prepare for that.
Well, I want to have a facelift. I'm considering a facelift and chemical peel. I want to get rid of the wrinkles here and the wrinkles in here, and I want to lift this.
So you've basically pointed to just about everything.
Correct. Move this face upward.
So you're telling me that you've had facial aging, okay? Right?
Yes, definitely have. It's drooped.
Leah is very typical. She doesn't want to be different. She doesn't want to be made different with the surgery. She wants a natural look. What she wants essentially is a younger version of who she is. And this is something that I know I can predictably accomplish. What we want to correct with you is the fact that you have aged.
Mm-hmm.
No big surprise. No. You are. And what we want to do is we want to make you look more rejuvenated.
Mm-hmm.
Part of the aging process has been the fact that a lot of your facial structures have just fallen.
Mm-hmm.
And what we want to do is we're going to put them back up, but in a natural way.
Exactly.
So we're going to elevate the brow.
Mm-hmm.
We're also going to elevate the temple region.
Mm-hmm.
And what that does is that you can see what that does is it gives you a nice, elegant look. As we move down, what we're going to be doing is bringing your cheek fat back up into your cheek.
Mm-hmm.
This is your cheek fat. We want to bring it back up and put it where it was.
Okay.
Back up in your cheek. We're going to define your jawline.
Mm-hmm.
When you're done with this procedure, you're going to have a gorgeous jawline.
Okay.
It's going to be nice and triangular.
Mm-hmm.
Because this is what we do all the time, I can tell you that this is going to happen.
Okay.
So I want to give you this confidence so that when you go in, you can feel comfortable that this is what's going to happen.
Mm-hmm.
By doing all these procedures and putting things back the way they were when she was more youthful, plus the chemical peel is going to be just a very dramatic transformation. We set the clock back a little, and it's.
We not only set the clock back. Forget that. I mean, we made me prettier. I'm prettier than I was, and I'm not used to it yet.
That's what it's all about.
Yeah, I was pretty in my pictures. My pictures when I'm 30 and 25. I was a pretty girl anyway, but now, I mean, it's. I stop a bit of traffic, on occasion, and I'm 52.
Gravity affects everything. It doesn't affect just one area. And her facial fat started to fall, and she started to have more of a square-shaped face. What we were able to do is to take her cheek fat and put it back up into its position that it was 15-20 years ago. And what that did is it gave her more of a triangular shape.
I'm very, very happy with the results. I would recommend this. Don't allow yourself to age like that. We don't need to anymore.